The strength of community engagement in a health system. Mahatma Gandhi once said, "The best way to find yourself is to lose yourself in the service of others." As a medical student at a prominent medical school in Guinea, University of Conakry, my dream was to become a cardiologist. During my student career, I volunteered, wrote, and defended my doctorate degree thesis in this department. I didn't think too much about public health. However, this dream had a sudden shift when my country, Guinea, was severely hurt by an unprecedented Ebola outbreak of international concern. With a shortage of public health professionals and a weak health system, Guinea was not prepared for this horrible disease. Due to the enormous damage the outbreak caused both economically and on human lives, one evening our president, Professor Alpha Conde, invited all healthcare providers to his palace with an earnest rallying call to help stop the Ebola virus disease transmission chain that was spreading throughout the country and West Africa like wildfire. In his plea, there was one passage that profoundly touched me. He said it with a heavy heart. "This disease has been here for several months, ravaging our poor population, but unfortunately, there was no qualified doctor in public health to report it." Added to this was the tragic death of my mentor and Professor Dr. B, whom we lost to this disease. I finally had my call. I realized that my services are pretty needed in the public health sector and the clinic. From there, I was hired by the World Health Organization, where I served as an Ebola contact tracer, field epidemiologist, and field coordinator. My tenure with this organization took me to many parts of the country and made it possible for me to know much about its health system and learn a lot. One thing I learned is the strength of community engagement in the improvement of health system. I realized that no matter our commitment to improve a health system, if the community is not part of it, it won't see light. And this is the change we would like to bring in this field. As President Obama said in his farewell speech, change happens when ordinary people get involved, get engaged, get together and demand it. We have decided to lead this change through a non-governmental organization called the Guinean Association of Health Emergency Response, which at the expense of blowing my own trumpet, I am the coordinator. How do we intend doing this? We believe that with the concept of health promoting school, we will kill not only two birds with a stone, but many. With this, we can address multiple health challenges such as low rates of immunization, multiple outbreaks, hygiene problems, civic education, and other health-related issues. Imagine each Mandela Washington Fellow educating 500 children about proper hand washing. We will have just sensitized more than 500,000 families. My Mandela Washington Fellowship will help me develop my leadership to enable me to realize this vision. I acknowledge that the work is so huge, but as President Mandela once said, every man can live above circumstances and achieve success as long as they remain dedicated to and passionate about what they do. I am dedicated to the Guinean people and passionate about giving them a sustainable health system. That is why I am confident that with all your hands on deck, we can successfully achieve such a vision of a child learning in a healthy environment. Thank you.